COVID has changed the way we live our life on a daily basis. And I think some of the good points that we can learn from COVID-19, I think we should keep it. For example, the social responsibility, how we take care of ourselves, as well as the people around us.
So I've been with HPB as a swabber for more than 7 months since then May. And then I want to actually use the time that I have during circuit breaker to do something meaningful and contribute back to the society. And since my father had COVID, I'm determined to do my best so that others do not have to go through the same experience as my family did. I was first deployed to conduct swabbing at the migrant workers dormitory in the first 4 months, and subsequently I was redeployed to be part of a roving team in September. Okay, I'm actually glad and grateful to be able to work on the front line during this pandemic, contributing and doing my part to help Singapore fight the virus. Also, many migrant workers spend a huge part of their life building Singapore. So I will actually be able to use this chance as a Singaporean to show my appreciation and that we care for them.
So as key partners to Ministry of Health, basically our role is actually to undertake the issuance of quarantine orders for PUQs, obviously persons under quarantine, as well as to try to do the transfers of the persons under quarantine to the government quarantine facilities or the GQFs. When we first started itself, I actually went on ground together with my people to serve quarantine orders as well. Subsequently, me and my key partners we started to oversee the entire integrated quarantine order services at the data management center itself, for example. Given the fluidity of the operations itself, protocols are always ever changing. I think as the lead role together with my commanders, the key thing is always to ensure a consistent protocol to allow our officers or agents to adhere to.
I'm a nurse clinician. My role is to ensure I maintain a clinical standard of the staff in terms of caring of a critically ill patient. For me, it's not really frightening because I know back during SARS period, because of the PPE, I find it's very safe, and compared to COVID, I think that the heightened infection control is more stricter. The most challenging for me is because of the constant changing of a policy involving the situation. So to keep the staff updated and to prevent them from confused, you need to really work closely with them, then ensure they are following the policy and the latest policy, because it keep constantly changing. I know that in nursing, every day I come is to help the patient which is in need. And I feel the satisfaction when the patient is under my care get better.
My role in NCID during COVID-19 outbreak essentially is a clinician as well as administrator, in a way that I need to understand the clinical disease and use that information to be able to run the entire organizations as effectively as we can, and also be able to bring in information to examine what would be the best preventions and interventions strategies. COVID-19 was a completely new disease when it first hit the ground. So everything is basically new. We have a new building, we have a new disease, and we just have to do our best to understand the conditions as quickly as possible, be as flexible as possible.
We did two things. One is to partner with Arcturus Therapeutics in San Diego to develop a vaccine against COVID-19. I am also working with a company that I co-founded with Professor Ram Sasisekaran from MIT, and the company is called Tycan Private Limited. And there we're trying to develop an antiviral drug in the form of an antibody against SARS coronavirus 2, so that we prevent patients with COVID-19 from getting severe disease. I think it's been especially gratifying to be able to see, all that we're doing is based on a lot of the science, the research that we've done in the past. And now we're seeing all that research now come to fruition, because in the past we tried to understand why some vaccines work better than others, what causes side effects of these vaccines and all that, all at the genetic level. And now we can bring that knowledge to now look at this new vaccine that we're co-developing with Arcturus Therapeutics, look at the drug and how to bring it safely into human trials, and hopefully that it will stand the best chance of working to prevent COVID-19.
I think overall Singapore has done well in our ability to cope with COVID-19 in terms of clinical management, the prevention measures that we have put in place.
Everybody is a hero, not only the nurse, the medical staff, even the cleaner as a team.
Besides braving the unknown, the key thing is that we realize that it's a sense of duty that we're supposed to do this in terms of actually to bring Singapore to battle this pandemic together as one.